Hi, my name is Christine Gannon, and I run the Sexuality Program for the Deaf at Planned Parenthood, Southeastern Pennsylvania. Each month, the Health Bridges website has topics related with healthcare and advocating for yourselves. This time, we're going to talk about taking control of yourselves related with your sex life. If you're currently having sex and you don't want to become pregnant, or you don't want your sweetheart to become pregnant, you can use birth control options. And those will prevent pregnancy. Planned Parenthood offers a wide range of sexual health services for a reduced cost for women, men, and teenagers all across the country. No birth control is 100% effective, but if you use it correctly, you're going to increase the effectiveness. It's a good idea to discuss with your doctor about the different benefits and risks associated with each birth control option. Making a decision for using a birth control is a personal decision and really requires for you to think about yourself, your partner, your family, and your future. You have a right to use protection every time and for every sexual experience. When you're making a decision related with birth control, there's many things to consider. First of all, how well does it work? How easy is it to get? Is it difficult or easy? Where can you get it? How much does it cost? What are the side effects? Does it prevent pregnancy but also prevent HIV and sexually transmitted infections, STIs? Do you have to use it every day or use it just periodically related with sex? If my partner doesn't want to help, can I use it by myself? Does that option fit my beliefs? All of those are things that are important to consider. Some birth control options require that you go to the doctor or go to Planned Parenthood. Birth control pill, the birth control patch, the birth control ring, or the shot. Women can use a birth control method with hormones, including the birth control pill, the birth control patch, the ring, and the shot, also called Depo-Provera. These methods use artificial hormones for preventing pregnancy, and they're very effective if they're used correctly, but they don't protect against HIV and STIs. One way that you can use to help you remember is to use a calendar, and you can help you remember when to go for a new birth control pill or go for another shot. Also, you can put down when it's time for changing a patch, taking it off and putting a new one on, or taking out the ring and putting a new ring in. IUD. IUD is a small T-shaped device that's inserted into the uterus by a doctor, and it's left there to prevent pregnancy. It tends to be very effective and it can be used for a few years. If you don't want it anymore, a doctor can remove it at any point. Just a piece of information, some IUDs and some don't have hormones and some do not. It's important to talk to the doctor to find the best match for yourself. Diaphragm. A diaphragm is shaped like this, and it's inserted into the vagina and it blocks sperm. The diaphragm, when you put it into the vagina first, then you have sex, and after sex is finished, then you take it out. It can be used for up to 5 to 10 years, but if a woman loses or gains more than 10 pounds, she might have to get a new one. If you use a diaphragm with spermicide, it can help increase the effectiveness. Implanon. Implanon, also known as implant, is a small, thin plastic rod that's inserted into the arm, and it's left there, and the hormones prevent pregnancy. It can be left in the arm for up to 3 years, but a doctor can take it out at any point. Just to let you know, this is a brand new method, and it's worth contacting Planned Parenthood to see if they still have it. Some birth control methods can be purchased at a drugstore over the counter. Condoms. Condoms, also known as rubbers, condoms can be used during sex to block sperm and bodily fluids. Male condoms are put on the penis, and female condoms are inserted into the vagina. Those are the only two that block pregnancy and HIV and STIs. Just a piece of information though, it's important to check the package to make sure that the date is still good, that's not expired, and that there are no holes in the package. Spermicides. Spermicides are chemicals that are put into the vagina before sex for killing sperm. They have all different forms. They have foam, they have film, suppositories, and sponge. Just a piece of information, it's worth using a spermicide in combination with another method to increase the effectiveness. Emergency contraception. Emergency contraception is also known as the morning after pill and Plan B, and it can be used as a backup if the condom breaks, if the woman forgets her pill, or if there's no protection used. It's a pack with 2 pills, and if there is no protection that was used, it can be taken for up to 5 days or 120 hours after unprotected sex. Emergency contraception protects against pregnancy, but if a person is already pregnant, it's not going to cause an abortion. If a woman is over 17, she can go to the drugstore to purchase it, or at any age you can go to the doctor or Planned Parenthood. Just to let you know, emergency contraception is effective for up to 5 days, but if you use it closer to after unprotected sex occurs, like the first or the second day, then it will be more effective. Abstinence, meaning no sex, is the only method that's 100% effective. If you do become pregnant, you still have options, and you can go to Planned Parenthood for more information. I just explained a lot of different information about different methods. All of these are not permanent, which means that if you want to become pregnant, you simply stop using them. Again, my name is Christine Gannon. You can call 1-800-230-PLAN, or you can go to the website www.plannedparenthood.org for more in-depth information or to find the health center closest to your home.